I'm gonna tell you guys a story about how I saw a physician kill a black patient on one of my rotations during PA school. My name's Tatum. I'm a new grad PA, and I did my rotations in North Carolina. I just wanted to raise awareness to some of these things that I saw, because a lot of the times we say, oh, we need to improve health disparities, oh, we need more representation in the physician assistant profession, and I'm going to give you a prime example of why we say all of these things. So I was in my ER rotation. It was my 7th out of 8th rotation. And something that they teach us in PA school is ACLS, which is Advanced Cardiac Life Support. And I was an EMT before PA school, so I was already BLS certified. So I know what it takes to save a person's life if they're, in respiratory distress, if their heart stops, all of that. And that's kind of what prepares you to work in the ER. So in the ER I was at, we had a lot of codes come in, a lot of respiratory distress, strokes, like we had a lot of just sick people. And one day we had an incoming code coming in, and the doctor, the med student, and myself and paramedic student, we all rushed to the room and waited for them to bring the patient in. So while we're waiting, the doctor, he doesn't really address PA students, paramedic students. He would only really talk to his med student. And so I remember the paramedic student came in. He was really eager, and like first thing he said was, "Can I intubate?" And I was like, dang. Because I kind of was like just standing in the corner because the doctor was focusing on his med student, and then the paramedic student was trying to get his skills. I wanted my skills, but I was kind of just there as an observer, hands-on. I had my gloves on just in case they needed help, because I know like how to go and grab stuff, go grab gloves, go help, blah, blah, blah. Anyway, that's besides the point though. So the patient's getting rolled in. The doctor is telling us kind of an update of the patient's status, and he tells the student, oh, patient's been they've been trying to get him back for a really long time. They've had to give like 30 rounds of epi. So what do you think his prognosis might be? And she was like, probably not good. And he was like, probably not good. And he's right. Like, that doesn't sound good. But as the provider, physician, whoever, it's our job to not determine the patient's fate before they come in, but to do everything that we possibly can to save them when they do come in, regardless of the prognosis or what you think is going to happen. Like, we are obligated legally or ethically to do everything in our power to save this man's life. So fast forward, the patient gets brought in by EMS. He's being bagged with a BVM. So they don't really have a great airway. I think they placed an iGel, which is like it's like an airway adjunct to help keep his airway open, so that while they're bagging him, they have the bag on him, so that they can reach his lungs and actually be putting air in his lungs. So they're bagging him, and we noticed that there's blood spurting out of his airway with each squeeze of the bag. That's a red flag to me. I'm already like, oh, we need to get a good airway, like immediately. So this patient needs to be brought in, connected, and he needs to be intubated immediately because he is in respiratory distress. So they get his vitals. Blood pressure was actually like low, but it was stable low. Oxygenation, low 90s, low 80s. It was kind of going back and forth. Sometimes it was reaching the 70s. So like, anytime a patient is setting that low, like they really do need to be intubated. They need a definitive airway. And as an EMT, they teach us ABCs: airway, breathing, circulation, which is your heart. So airway is always first. So they bring the patient in, and the MD is talking to his med student. He's like, okay, I'm going to have you do a central line on this patient. Sir, the patient does not have a definitive airway. Are you sure that you want to go with a central line right now? Which is one of the respiratory therapists and nurses were saying that to him, and he's like, no, we're just gonna get it really quick. So he's gets all the central line stuff. They get sterile. Mind you, this is a sterile procedure, so you have to put on a bunch of gear, you have to wash your hands, you have to get everything ready, you have to set up, you have to put everything together. And he was trying to teach the med student to do it. Mind you, she's never done one. In the middle of the procedure, after they've already gowned up, they're sterile, everything, he's like, have you ever done this before? She's like, no, I've never even done an IV. So I'm just like, what are we doing here? The patient his oxygen is going like this. He's going from 70 to 60 to 50. They're bagging him. There's resistance with the BVM. You don't want resistance with a BVM. That means you don't have a good airway, so he need to be intubated. So everybody in the room is looking around like, okay, are we gonna intubate this patient? The head nurse that was in charge of the BVM was like, I really think that we should get an airway because he's desatting. So it's not working. He's just like, we're almost there, we're gonna get it. So eventually he realizes like this is not gonna work. So he stops the teaching moment of teaching her how to do a central line in that moment while this patient was essentially dying in front of us. And he's like, maybe we should get an airway at this point. And the part that got me is like, while they're trying to, so a central line is like basically a needle is going in your femoral artery. So they have to go kind of right here in your groin. And sometimes, like, I think the humane thing to do would be to numb the area before you do it with like lidocaine or whatever the case may be, that you can numb the area so it's like not so painful for the patient. So this is when we realize like the patient is still alive, the patient is still with us because he's reacting to the central line that's right there. And so basically he's in pain. He can't breathe. He's suffocating. He can't breathe. He's not getting oxygen. They can feel that he can feel this. And one of the nurses is like, sir, I think he can feel what you're doing. Maybe we should numb him. And he's like, no, he's fine. He's fine. So then they proceed to fumble and try to do the central line. Eventually he's finally like, okay, let's not do this. We need to get an airway. You think? So then I'd say maybe like 10 to 12 minutes have passed, and this patient's been like, his blood pressure was like okay, it was starting to get a little lower at this point. Oxygen was crap. He was in the 70s, the 60s, getting down to the 50s at this point. So he's like, okay. And then mind you, the paramedic student said in the very beginning, can I intubate? He could have been doing his intubation while they're doing the central line. I could have done the intubation while they're doing the central line. We had a lot of like people that were qualified to intubate this man. So we're moving along, and he decides to intubate. They drop the intubation like that. It's a really quick procedure. He lets the med student do it, which is fine. She did a great job. She intubated him. So then the next thing, once you intubate a patient, you want to check to make sure that you did it right. So you check the CO2, you come in, bring an x-ray to see that it's placed right, because the tube has to be right down the middle. So they do that. Meanwhile, the patient is intubated. He has the tube in, but he's trending down on the sats. So typically what we do in these situations is we have to increase something called like the PEEP or something on the vent settings. It has to be increased to allow the patient to get more oxygen in his lungs. So patient's setting at like 40, 50%, 30% at this point while intubated. He still has blood coming out of the tube. So something's really damaged in here. Long story short though, the patient did not make it. We bagged him for, as long as we could, but I think like right after we got the x-ray for the intubation, the doctor walked out to tell the family like, I don't think he's gonna make it. And essentially what it looked like to me, tried to convince them to pull measures like basically us stop CPR, us stop everything. So what happened was he's desatting, and once you start to desat so much, your heart usually will stop at that point. So his heart did stop, and we did have to start doing chest compressions on him. We did bring him back after like maybe 2 rounds of compressions. So we did bring him back, but he ended up ultimately dying, because once you have that much damage, once your brain has gone that long at like 60%, 50%, 40%, 30% oxygen, it's just not sustainable for you. And even then, you're gonna have long-term brain damage. He's not gonna have a great quality of life at that point. So he went and talked to the family and like convinced them like, let's pull life-saving measures from him at this point and let's just let him die, basically. And I remember seeing one of the nurses, she was black. She just kind of stormed out of the room, and she was really, really upset. And I felt that so much because I was just so upset. And then watching the family come in, get by his bedside, and we all just leave the room, and they're crying. And I'm just looking at this man. He was an African-American man, and I'm looking at him like, we just killed you, basically. Like, we could have done way more to save your life. And I felt so disappointed in myself for not speaking up more. But it's like, I'm a PA student. They don't even see me in the room, basically. But yeah, that is basically my story of why we need more representation in the PA profession. We need more black people to advocate for ourselves. More people of color in general, just to advocate for ourselves. And we need to start holding people accountable for these things, because there's no way that man should have died that day. Like, if we had done everything we could, I get it, but we did not do everything we could. So that's definitely a story from PA school that still haunts me.